So joining us now is Christelle. She's an RN stroke navigator at Community Regional Medical Centers, and we're talking about something that's really important in I think everybody's life. I know several young women who had strokes before they were 30, and so this is a really important topic that we're talking about. So we're talking about strokes and why it's so important to identify signs and symptoms as early as possible. So what do you tell patients who come in to see you?
So with stroke, we typically tell our patients the acronym of BFAST.
Okay.
And the B stands for sudden onset of feeling off balance, lightheadedness, dizziness. The E stands for eye or vision, sudden onset of blurred vision, double vision, difficulty seeing, focusing. The F stands for face. You can ask them to smile and see if they have a facial droop, and most times that will indicate a stroke. The S stands for speech. Asking them to speak to you, say something to you. They could have slurred speech, they could have difficulty speaking. They might not understand what you're asking them to say or to do. And then T stands for time. Strokes are medical emergencies. The sooner a stroke is recognized, patient gotten or the person gotten to the emergency department, the sooner a diagnosis can be made and treatment can be started for these patients.
Okay, so BFAST is a great acronym to remember and try to commit to your memory to remember all those symptoms. But do all of those symptoms have to happen at the same time, or could you have one or maybe two of those symptoms?
You could have one or two, and then you have patients that might present very differently, that they could be having a stroke as well. So as I said, you could have one, you could have two, you could have all of them. Each stroke is very, very unique and different to that patient.
Right, and so at Community Regional Medical Centers, what is the care like? You know, what do you guys put at most importance when you're taking care of stroke patients?
Well, each patient is individual, and we want to provide that individualized care for that stroke patient and their family. And our care actually starts with our EMS partners. Most times a stroke is recognized and the person or the family will call 911. So this activates the EMS. They'll go to that person's house and they will use a validated screening tool in assessing if this patient is a stroke patient. They'll stabilize the patient. They'll then load the patient into the ambulance and take them to a designated or an appropriate facility. While they are en route, they will also notify our emergency room. We have a radio room in our emergency room. So that makes staff aware that there is a potential stroke patient coming in. Because as I said, T stands for time. So if we're aware that this patient is coming in, our emergency staff will be prepared for this patient, which means that our highly skilled staff are ready for this patient. Our neuro perfusionist or our perfusionist nurse will be ready. The ED providers will be ready. The neurologist will be made aware that this patient is coming in or is there, so that they can do a rapid assessment of this patient, a physical, a neurological assessment. They'll get a history of the patient as well. For example, medications that they might be using, any blood pressure issues. When was the patient last seen normal? When did the symptoms start? Because that helps us as well to determine, you know, what form of treatment, can we give this treatment or not. Everything happens very, very rapidly once the patient gets to the emergency department. It's not one person does this and then waits and another person does something. Everybody jumps in at the same time because we want to see what is going on. So the assessment is done, somebody starts an IV, patient is placed on a cardiac monitor, labs are drawn, an EKG is done on this patient as well. And one of the very first things that we want to have for our diagnostics is a head CT. We want to see, is there a bleed? The CT, the non-contrasted head CT, tells us if there is a bleed, because that will also guide us into the treatment that we're going to be taking. If the patient does not have a bleed, do they meet the criteria for the thrombolytic, or what's sometimes referred to as the clot buster? Do they meet the criteria? Not all of our patients meet the criteria for that. Some of them might need what's called a mechanical thrombectomy. There is a clot that can be removed.
Okay.
Correct. And sometimes patients have the clot buster, the IV thrombolytic. They have the mechanical thrombectomy. They have both.
Yeah.
Sometimes patients don't benefit from any of those, and then we do just medicine management for those patients.
Right. And that was gonna be one of my questions is what are the outcomes? You know, what's your desired outcome when you send a patient away after they've had a stroke?
We typically would like all of our patients to regain as much functioning as possible after a stroke. We would like them to be as independent, self-sufficient as possible after a stroke. And some of our patients do really, really well. They don't even need any rehabilitation services once they've been discharged from the hospital.
Right.
Other times, patients do need those rehabilitation services, be it physical therapy, occupational therapy, speech therapy, and we start our therapy in-house already.
Oh, okay.
You know, as soon as the patient comes in, our neurohospitalists or the hospitalists, they would like PT and speech to see these patients, and then depending on their recommendations, we might also have occupational therapy see those patients. But we really want to see, do they need any equipment when they go home?
Yeah.
Do they need outpatient therapy, or would they benefit from our inpatient therapy? We have our LSP or Leon S. Peters acute rehab in-house, which is fantastic for our patients. The staff there are fantastic as well. And if our patients cannot get their rehab at our facility, we do refer them out to San Joaquin Valley Rehabilitation as well, or other facilities that can provide the care. Some of our patients need to go to a skilled nursing facility and get the rehabilitation there that they need. And as I said, some patients don't even need rehabilitation because their functioning is really almost back to how they were before they had their stroke.
And so the BFAST acronym is really important because the quicker that you act, the more likely your outcome will be like what you described there, where you don't need any intervention after you leave the hospital. This is all great information, and there you guys have tons of information about stroke education. Where can we go if we want more information about stroke education?
We actually have this book on our forum, or if you go under CRMC Community Regional Medical Center, you can look for this book and it'll be available. We have it in English and in Spanish at the moment, so it is a great resource for our patients. It talks about the different kinds of stroke, for example, the transischemic attack, the acute ischemic stroke, the hemorrhagic stroke. It also talks about life after stroke. We have different resources like how to build a ramp or how to get up if you've fallen. We have nutritional information in it as well, because nutrition does play a huge role in being healthy.
Right.
You know, you want to manage your blood pressure, you want to manage your weight, you want to be physically active.
Right.
So those are some of the things that can be found in here as well.
Okay, perfect. Christelle, thank you so much. She is a registered nurse with Community Medical Centers. Great information to provide us today. Everybody know your numbers and be fast. Thank you so much.
Thank you, Emily.